Hello, and welcome to the Cash Practice Solution Podcast. I'm your host, Dr. J. Today, we're going for the deep dive into pricing, and specifically the pricing mistakes I made when I first opened my cash practice. So I have some experience. But if you're eager to escape the constraints of third-party interference and embrace the freedom of a cash-based model, you're going to want to stick around. These lessons could save you time, money, and frankly, headaches and heartburn and all sorts of other bad physiologic outcomes. If you don't know that you're suffocating from third-party interference, you're not paying attention. So let's just start with a fundamental concept in economics, which for medical practice and for doctors, it's revolutionary. But imagine you have a choice between a Porsche or a Kia, and they're both at the same price. No brainer, right? Quality and style matter. Like cars or any product or service, healthcare quality varies from one encounter to the next. The physician's experience, skill, and passion make a difference. For instance, a physician with 40 years of experience and an obsession with staying current with the craft is obviously going to provide more value than a new grad who wants to get out on the golf course. Can't blame them. Take a long break from the literature. Porsche or Kia, right? Patients know this. They can sense it in every interaction. A knowledgeable, committed physician is worth way more than the RVUs, which is, for those who don't know or haven't experienced the pain of Medicare jargon, relative value units that's assigned by some bureaucrat in a far-off city. Medicare guesses on pricing based on where you live, your geographic location, the intensity of the work they think you do, and practice expenses like malpractice and rent. But this doesn't consider any of the quality measures that matter to the patient, right? How the patient feels, how they experience it, that has nothing to do with it. But it has everything to do with it because the patient's the point, right? So as long as the basic standard of care is met, the physician is regarded by third-party payers as a widget. They're all the same. She's a generic cog in the machine. But an experienced physician can wring out more efficiency for a while, and eventually they're just going to get squeezed so hard that their quality is going to suffer. Even the very best doctors with the best intentions because of the way that the payment works. And eventually the gap between good and really excellent becomes just this huge yawning abyss. There's just no way that you can do your best work. No practice can justify it. Pricing needs to reflect the quality of the service or it's going to suffer. So ultimately, the quality of the patient experience should be the whole point of healthcare. So what are patients looking for that escapes third-party payment logic? Okay. Attention and compassion? I don't think Medicare pays for that. They're not on the list. Improving quality of life? In other words, the patient who comes in and says, man, I feel so good. That's not a metric that's used. Nope. How about cutting down medications with lifestyle and nutrition plans? Not only the patient lists I see, instead I see this gigantic list of medications that have just been going on and on and on. And I could go on. There's tons of things that Medicare just doesn't and can't possibly significantly appraise. They don't know. So what's the solution? Ignore Medicare's one-size-fits-all payment model and base your pricing on meeting your patient's needs. And then their willingness to pay for the quality. So payment that matches quality is simple economics. Kia or Porsche, right? Uncoupled from government price controls, which always create shortages, it's going to work, and it works for us. So let me give you an example of money well spent. This is really a way to look at how much you should pay based on how things really work versus the widget mentality. So we have a young lady come to the practice. She's 21 years old. She's been taking semaglutide since January, about a half a year. She's got nausea. She's got increasing constipation. She's weak. And she starts to go see doctors. Many doctors, 11 doctors. She gets a week of inpatient care and racks up $90,000 in medical expenses for this treatment protocol. And she's not a bit better. So they call our office and we give them our pricing and find out that in our discussion that she's bedbound now. She withdrew from college for a semester And so what we do in our practice to just really accentuate the quality, before a patient comes in, we have them do a symptom assessment. We use AI to do it, and we use symptom assessment technology so that we can have a really good idea before the patient comes in what we're going to do. So we looked at it. She had some enzyme problems with digestion, the constipation with slow transit time. She had anxiety, of course, because she thought she was going to probably die. So after having that assessment done, we scheduled an extended appointment so we could listen to her story from her perspective. Now, I had the data of her symptoms. Now I wanted to hear her story. We did a thorough physical. I actually put my stethoscope on her abdomen, and she said that in the entire time that she had seen doctors, nobody put a stethoscope on her belly. And she had constipation and belly pain and all this for half a year. She said it never happened. And because I'm an osteopath, we did a structural assessment, and she kind of checked out how her physical structure was working. So we treated her based on that information, and it was about an hour-long appointment to get the information. I listened, and I learned her story. So our treatment was nutritional support with digestive enzymes and some magnesium and adrenal support. And because we have a cash practice and we can treat the patient with what we think they need in a single appointment, we don't have to schedule them for several appointments to come back because the insurer won't pay. We included acupuncture and some hands-on therapy to address the autonomic switches that make her belly not work. And at the 2-week follow-up, she was completely recovered. One visit. She returned to school, normal appetite. So price-wise, no benefit, lots of stuff, tremendous hassles, half a year of her life, missing school, $90,000. For us to achieve a complete recovery, one visit and a follow-up, total cost, lab, nutraceuticals, treatment, everything, $1,900. So you figure that's about a ton of money. I don't know, what is it? $88,000 difference, and no benefit. Quality matters. So the patient is not going to be quiet about this, right? She's going to have lots of good things to say about us. So let's explore the pricing mistakes I made before this beautiful thing happened. And basically, having reversed these, we can do these things for patients. So this young lady with gastroparesis, we can get her better. We can do it in one treatment. We can do it because we've developed all of the things that a cash practice can do that you cannot do under a third-party payment structure. You can't do it. They won't pay for it. They make the patient come back again and again and again. You lose the momentum for the patient. You lose the opportunity. So first thing, I priced based on competitors. I looked at what nearby practices were charging, and I tried to set my prices kind of like that. Huge mistake. It led me to undervalue what I was doing. And so instead, you should look at your skills, experience, and results. And doing that, which I've done, brings the payment structure much, much higher. I actually worked with a doctor locally here who he needed to leave his practice. He needed a little break, and he was charging $19 a visit, which that's very inexpensive. And I thought, we can probably do better now. We can do $29 a visit. And when I did that, the patients were so mad for $29 a visit. So pricing is not something that you can do based on somebody else's experience. You have to base it on what you're providing. And that's your unique selling proposition. It's called a USP in business. So people know a USP is like, well, what do you do that's special? What kind of special training did you do? What do you love doing? And in that, and when you do that, patients are going to understand that they're paying for something that's very valuable. And when you don't communicate that value, like I didn't, I could have communicated my value much better, and I didn't. Mistake two. Patients need to understand what they're paying for. You have to take the time to explain your approach, the benefits they're going to get, and how it differs from a traditional model under third-party payment. And you know this is a huge move in healthcare now. Transparency is a key. Transparent pricing, of course, is on the menu for everybody. But even more than that, transparency in terms of treatment that they're going to receive. What are you going to be able to provide them that's different? And our front office staff communicates this really, really well. Patients know that they're going to get a really good symptom assessment. They're going to get a very good visit. They're going to get all sorts of treatment that may not be available elsewhere, which I've been able to develop because I have a cash practice. And I can do these treatments in a single visit and get paid for all of them, as opposed to a third-party system where you can't. Mistake 3, ignoring patient feedback. I didn't really look for what patients had to say about pricing. I had one gentleman, his banker, who said, if I knew all the pricing before I came in, I'd be much more comfortable. So we've developed that. And now we have our prices are transparently posted. If they have any questions, they can ask staff before they start. If they have any questions of me, I know what I'm charging and I can tell them. I can give them a ballpark figure. Ask them what they value most and what they'd be willing to pay for. You'd be shocked. Patients are so willing to pay for something that gives them convenience. We do cryosurgery with a little freeze gun. And patients don't want to have to go to a dermatologist 11 times to get 11 lesions taken off. They'd much rather have, during their consultation with us, could you also do, and yes, of course we will. We'll do the cryo. And we're happy to do it. And there's multiple things that we do that are like that. And this kind of insight, asking the patient, what would you like? What would work for you? And patients will tell you, they're happy to let you know the things that bother them about the other environments they're in, that you can say, well, you won't be bothered by that here. We'll take care of that for you. And you can do it. And finally, like in mistake 3, that's just all the things that you can possibly offer. And what kind of tags on that is if you offer a patient a visit and then you add things, sometimes payment, it's a little tough. So at first I just said, just pay for all of it. And I didn't give a lot of flexibility. So eventually what I decided was if patients are going to add extra services, they need to know what they cost, but we can be flexible with their payment. We can let them pay out, can pay over a few months. And we give a ton of discounts. We just gift a lot of services because it's a really nice service. It's a really nice gift to give to the patients that it's good for business and it's kind. So finally, branding. I'm your host, Dr. J, and that's also my brand for the practice, Dr. J, Regenerative Medicine. Your brand is your promise to your patients. So when Dr. J, Regenerative Medicine, provides a service, I've promised them they're going to get that quality. My brand is my assurance that they're going to get with that service, that kind of quality. And when I see somebody out in town or whatever else, they call me Dr. J. And at first, I didn't really embrace the idea of being branded, but it's a huge benefit because patients will be able to say, I see Dr. J. Dr. J provides these services, and they're willing to pay way more for something that they know has a high quality that's associated with an individual. So in your practice, if you haven't branded yourself personally, think about it. It's pretty amazing what a difference it can make. So you might ask yourself the questions, hey, well, how do I do this just simply? How do I set my prices effectively? Let me give you the quick list. Evaluate your skills and experience. You did a fellowship in dermatology, that should be on your list. You should be able to say, based on that skill level and my experience with it, I should be able to charge more for that than a GP who's not really studied it, right? So you should pay more. That's not the way that the third-party payment works, as you well know. So, skills and experience. Research the market. Understand what similar practices charge. When I mean similar, Dr. J Regenerative Medicine, we provide a very, very high level of service. We provide lots of time with the patient. We provide lots of customer support, as opposed to an urgent care center where patients roll through and roll out. That's a similar practice for a real quick GP practice, but not for ours. A similar practice for ours is much more of a med spa level or something where patients have lots of attention and lots of care. So look at those practices, look what they charge. Don't mock their charges, don't follow their charges precisely, but know that that's going to be the range probably that's reasonable. Listen to your patients. Ask them for feedback. If they're struggling with your prices and you've got some curiosity about it, you can play with your prices, move them up and down, see what needs to be done. Be transparent. Transparency kind of is the holy grail right now with third-party payers, of course, but also for us in cash practice, you want to be transparent. Just communicate your prices clearly. People are not happy with being shocked. They're very happy for $1,900 instead of $90,000 getting well. But $1,900 is still a lot of money. That's not cheap. But getting results and knowing that you're going to get those benefits and transparency, they're overjoyed. And then offer flexibility. I think that that's really important because some people are concerned about, well, what about people who don't have a lot of money? Well, you can give your services away. That's something you can do. And we give 20% of ours away. And we're happy to do it. And we also make payment options available to people who can pay over time, who maybe can't pay for a service in full at the time of their service. But we always like to get paid in full if we can. But be flexible. It's really important. So remember, pricing isn't just about numbers. It's about the value you're providing and how you communicate that to your patient. They got to know it. They got to perceive it. Like, oh, that's right. I'm getting this great thing. Transparency, right? Avoid these common pricing mistakes and you'll set yourself up. You'll be on a path to a really successful cash practice. So thanks for joining me today on the Cash Practice Solution podcast. Don't forget to check out our cash practice scorecard at cashpracticesolution.com to help you guide your decisions. Now, if you found this episode helpful or maybe hopeful, please share it with your colleagues who could benefit from it. And until next time, remember the keys to success. Listen to your patients. Learn their stories. Love them with your whole heart, and you will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.